Now, ladies and gentlemen, the next session that we are getting into is the P4 healthcare model, which is predictive, preventive, personalized, and participatory. This truly represents a fundamental shift in how we approach longevity, disease management, and patient empowerment. So, this next session is again a presentation which we'd like you to focus upon. And for this, I'm inviting on stage Dr. Arjun, who's the medical director for AMTZ, which is Andhra Pradesh MedTech Zone. So I'll invite him to please step up onto the stage and share his presentation. Welcome, sir.
Jai Hind, everyone. Good afternoon. I am Dr. Arjun, currently the medical director at Andhra Pradesh MedTech Zone. Dr. Giridhar sir was mentioning that India has come up with medical technology zones. I represent one of the medical technology zones called Andhra Pradesh MedTech Zone. I'm also part of Kalam Institute of Health Technology, where we congregate research from across domains. So this presentation is one of the a group discussion that we had with multiple stakeholders involved with health, and we have put this together. So we have different models of healthcare, and so far we have been looking at public-private partnership, and we would like to extend it to people, including into the partnership so that we get the feedback directly. What is voice? So this session is called as voice. What is voice? Voice has many definitions, but one of the most beautiful ones is the expression of an individual which impacts one who is receiving it. And here, every one of us are truly the voice of healthcare. What we express is going to have a short-term or a long-term impression on everyone. And then, of course, we have the ancient land of Bharat, the land which has been a treasure trove for thousands of years. And today, with the new interventions which are coming up, the modern science and technology which is coming up, how can we merge all of this? Okay, so when it comes to health, there is a certain definition of health. Health comes from the Old English word heal, and the past tense of heal is healed. So in the Old English word, health means healed.
It's working now.
So, thank you. So healed is what health stands for. So here we are, constantly healing. Every single moment of time, our cells divide. Depending on the environment, depending on the toxins, depending on the availability of resources, the health is a dynamic situation. And because of that, each and every one of us, a mother, a father, a teacher, every single individual is truly a hero towards healthcare. Healthcare is actually not a boring system, it's a quest. If somebody is sick, a doctor tends to see, why is this person sick? Why is my child sick? A mother wants to know. So every single individual is truly a hero for healthcare. And the villains, what are the villains in this story? The villains are pollution. Pollution is a villain. We know the soil, air, and water pollution is definitely something which is ensuring that the quality of health drops. We know the food quality, if it is not good, it drops. Inequality, where we have a superiority complex which runs in some people, or sometimes inferiority complex which runs in a group of people, can actually impact the delivery of health. And finally, the lifespan which has not been measured appropriately. So what does this P4? We do have multiple definitions for P4, but for this discussion, I would like to take the public, the government bodies which is collecting the data, the private sector, all the individual group of companies, and the partnership which can happen with the people, the direct users of all the care and delivery that we do. So what is Ayush? Ayush is a very old Sanskrit term which means quality longevity. Ayush stands for quality longevity, and today, because of the medical modern interventions that's available, we know for sure each and every individual today can live up to 100 years. That's something which we can promise if we take care of our health. There is science that can support this. There are tons of research which is coming up. So taking this further, let's have this entire healthcare scenario taken up as a game. Why game? Because if the end outcome is every individual must have 100 years, it can be structured, it can be tailored up. So the first component that we take up is capital transformation. We'll go into this. So capital transformation. As of now, we have been considering capital as the cost of treatment, cost of infrastructure. But it's about time we change this entire paradigm towards cost of life. What is the money, what is the amount of capital that we need to ensure the cost of life? And how can we do this collectively? Health is not a luxury. Health is necessity. So one of the key things which our ancient Indian texts bring is there is no cost of life. It's gift of life. Every single life is important and must be upheld. And then we go, if we can take up, what do we need to do in the level 1? First is the change in the definition that we have to go. The capital transformation must become the cost of life transformation. This is the first essential direction that any healthcare organizer can take up. Then we have healthcare resources are currently working in silos. It could be a single hospital, it could be a single individual who has a certain amount of data. We have to put it all together. When this infrastructure evolves, there are humans, animals, environment, the entire thing, the one health spaces begin to evolve. One impacts the other. The indiscriminate use of resources is actually impacting the environment and animals. And that, in fact, reverses back and it hurts us again. So when we are looking at healthcare, it becomes extremely important that we look at it from this core paradigm, the soil, the water, the air. This impacts health directly. And then we have, as of now, we have been talking of rural disparity. But what's really ironic is this. Health in the urban systems is actually not good. What's the quality of life for a person living in city? Yes, he or she might have access to hospital. But what we know for sure is the quality of children who are in rural systems. They have better milestones reached than the child who is in the city. Most of the cities have a really, really large number of hospitals, or rather schools, for children who have not reached milestone. And why is this? That's because, like we discussed previously, the air, soil, and food has actually been compromised. So the next phase of this direction where we are going is the entire urban system will go through an overhaul. It could be working with the rooftop gardens, breathable cities. The soil in the city should be something, or the water in the city should be something where the child can drink directly. The earth source water is something if the child can drink directly. That's when we know we have achieved the quality healthcare that we look for. So in India, we do have the data which is coming from multiple different systems which has been running around for tons of years. And integrating them, all of it becomes a very important picture. So this is AMTZ. This is where I work. And what we are looking right now is something called as the Beyond Blue Revolution. So you must have heard of these blue zones where people live for 100 years. What if we can bring the principles and the strategies that's happening in those 100 years achieved zones and bring it to the cities of India? Now, that's a direction which every single healthcare organization can take up. And with this regard, I would like to say, in fact, AMTZ is coming up with chain of hospitals. We are working on something called as Made in India Hospital. All the equipments in this zone will be made in India. We are looking for partnerships. Those of you who are interested, please reach out to me after this conversation. We'd love to take this forward. We go towards the next level to how do we work towards it? It's rural, agro, and forest health. The tons of resources which is actually available in our farms, in the real nature, has not been accessed. We have not looked at zero harm waste systems from our healthcare. The entire hospital, we are still dumping most of our medicines under the ground. We need better systems. Until we fix what we are hurting the system near the nature with, we might not be able to achieve the dream that everybody seeks. Of course, honoring the traditional forest communities. Now, this is something which becomes extremely important. They are surviving. Some of them are living for 80, 90, 100 years and working. They have something that we don't know. And what is it? How can we bring it to the mainstream? So schools, now this is where we would like to introduce a concept called transforming school into health labs. Why do we need education? Education is so that we survive. Education is so that we get money, right? Everybody wants to be healthy and happy. And the schooling system was designed, was tailored. Some say it was for the industrial evolution, but this is actually the core purpose, to survive. And if the schools can teach the system, how can we help a better healthcare model? How can we bring the knowledge, skill, and attitude of healthcare into academics? How do we help the children in achieving milestones that the child has not achieved? Many times, a lot of children, a lot of parents don't know the child is actually not reaching up to the milestones. What are the strategies that needs to be put? And of course, once we have the data collected from one place, how can we bring about a joint process? Next, the students have to, we must use the healthcare resources. The students can be used as river rangers, eco-auditors, or the mentorship programs where we can bring the children to test the soil water and partner with the existing municipality, the hospital. This is a very big step where if the local hospitals can partner with schools and universities and start working towards rectifying the water, drains, soil, it's going to be a very important step. Bridging the wisdom. We have the knowledge that we need, but we don't have the system to receive or share the knowledge. This must become a very important step through. Hospitals are currently being looked upon. It's a silos. We have the gestational episode of disease, the data of the disease, and then we believe that's healthcare. No, that's disease care. The healthcare is another domain, a domain which has much more data that can be collected, that lot of data that can be put together, and we can actually work along with this. Prevention first is, everybody talks of it, but what are the strategies that we need to be doing? How can we help it rectifying from the core? Nutrition, water. This is something which I've been working with children who have not reached their milestones for a very long time. Cities, the children are consuming food that's laden with pesticides and herbicides. It's grown from a same plot of land, and the mineral content in that is much lesser than the child who is receiving the same kind of substance in a village. So we have to be working in a completely different way. Take a detour, look at the reality with the data, and then take this step forward. And finally, if we can manage to go up, level up, we will be able to build eco-sealed systems. This is where every water, soil, food, and the designs can be democratic and openly achievable for everyone. And this is, it's a boss level. Since it is a game, our aim is to ensure that everybody gets 100 years, everybody wins, everybody is rich. And in this, if we can create a system where it is patient-centric, truly every doctor is actually serving the patient. Every healer is actually serving the patient. And in between this healer and somebody who is suffering, we have this entire system of healthcare organizations which is supporting the care. If that can be tailored better with the power to people and keeping the vision of a long, strong life, if we can do that together, I think we are in a good place. Now, coming to what is the call to action? If each and everyone here, if you can get one meal, just one meal without pesticides and herbicides in a day, we win. If we can aim for that one direction, that is the direction which as a healthcare system, as a healthcare organization, we can plan. Now that's the first step. And if we can give it to every child that's going to be born in this country, if we can make that food available to every child, then we are in a much bigger step. And then, of course, collecting all this data, putting it together, and amplifying the entire system. So finally, why all this? All of us want to be healthy. All of us want to be happy. This is the bottom line. Everybody. Why do we need money? Why do we need power? Why do we need knowledge? Bottom line, we want to be healthy and happy. For ourselves, for our loved ones, for our family. How can we do that? And if we can aim a quality, longevity for every life. I'm really sorry. This is actually a work that has been put together by multiple teams and from Kalam Institute of Health Technology. Thank you so much for your time, and we'll be moving on to the next session. Those of you who are interested to work with us, partner with us, please reach out to us. It's our honor, and it's definitely a privilege that we can work with people with such vast knowledge. Thank you.
I'll also invite Dr. Naveen to please kindly join and hand over a small token of our gratitude here. Please.